So we are here with husband and wife, Debbie and Mark, and they're gonna get facial rejuvenation in a couple of days. And we're gonna start with Debbie. She's beautiful, as you can see. She didn't need much, but we're gonna do a little bit of a brow lift, just to kind of lift this up here and reposition her brow. We're gonna do deep plane face and neck lift. If you can see, her nasolabial folds and mid-face descent kind of corrects when I lift up like this, and you can see she's got some bunching here. So when we do our brow lift, what we're really doing is redistributing this so we don't have to make an incision here. So that's the deep plane brow lift, deep plane face and neck lift, and you can see she's got a decent amount of skin here that is going to be taken off, but we're not really interested in the skin. We just reposition the muscle, and whatever skin comes off we remove. And if you notice, when and this is a view, I call it the cell phone view, because when people are looking at their phones, you see there's a lot of excess kind of skin and laxity here. So we lift all that up, and when I do both sides and I lift and they tuck their chin down and there's still a little fullness, then I know there's something in the deep neck, probably some deep fat under the platysma. She's got a little bit of ruddiness and a little bit of like pigmentation, so she's definitely going to benefit from laser resurfacing. And we're going to put a little bit of fat to kind of pad the areas that are a little hollow. So we're going to use our own fat to do a little bit of temple filling, maybe just a tad in the cheeks, a little bit in the nasolabial folds and around the mouth. And then lastly, we're going to do probably a little, like 2-3 millimeter lip lift. Debbie, I want you to open your mouth like halfway. You can see you don't see any teeth. Smile, Debbie, and then relax now. So you see there's a little line of demarcation there, and if you just go like that, you can see some teeth, and you see more red lip, and hopefully no more fillers.
No more fillers.
No more fillers. And when I take fat out, and if I see they need in the hands, we put some in the hands too, and it makes it look less thin and fuller hands. Any part of your face, if it's body, face, hands, if it's fuller, it looks younger. So let's go to Mark now. Mark, he says he didn't get compliments on his eyes anymore because nobody can see his eyes. So we're just going to reposition the brows. Remember, in male brows, you don't want to go too high. You just want to reposition. He does have a little bit of excess skin, so we're going to do an upper blepharoplasty on him too. You can see just the difference from here down. You see everything's kind of hooded this way. So we're just going to go up like that and just open up those eyes. So that's going to be through a brow lift, upper eyelid blepharoplasty. His lower eyes are good. He is going to get a laser. And then, of course, a deep plane face and neck lift. Both of them have taken some of the GLPs. So that kind of thins out your face in a different way than just losing weight. But he's going to look great. We're just going to, you see how much bunching we have here when we do that, right? So, and brow lift is going to look amazing. And just a little note about, like, you know, these incisions are going to be in the hair, but any part of your scalp that's had hair on it at some time, incisions heal well. We've done bald men before. They heal really well. You can't even see the incisions. Mark, tuck your chin down a little bit. So even on Mark, he looks pretty good when you pull, but there's still a little fullness here. So we're going to look to see what that is. And I felt glands. The glands just aren't that big, and they look like they tuck pretty easily. So we're not going to take out glands, at least now. But intraoperatively, maybe a different story, but I don't think so. Okay, that's all we got.